All right, guys, welcome into chapter 7. Today we're going to be talking about shock. And I know we introduced this a little bit earlier in the semester. This whole chapter will do a more of a deep dive into it. So, shock is first to understand shock, you have to understand blood flow in our body. And we talked about this in chapter 3 a little bit. Perfusion, the definition of perfusion is delivery of blood and oxygen to all the cells in the body's tissues and organs. And this is, again, through blood flow. Hypoperfusion is when blood flow fails. The cardiovascular system fails somehow, and blood circulation eventually ceases. So the body is unable to deliver blood to the tissues. Now, this is a quiz question. Make sure you understand what hypoperfusion means. Okay, that hypoperfusion is another name for shock. Now, shock, again, can be very damaging to the body because the lack of blood flow leads to a lot of damage in the body, right? The brain, the abdominal organs, skin, and muscle cells, when those don't get oxygen through blood flow, they die, right? The brain's fairly quickly, it only takes 4 to 6 minutes for the brain to undergo significant damage. Abdominal organs take longer. They take 45 to 90 minutes before they start to undergo a lot of damage. And skin, the longest. Skin and muscles, they only take about 3 to 6 hours before it causes a lot of damage. But even then, like the timing of all this is important, that we get this person help to get blood flow restored as soon as possible. All right. So this is a quiz question. Make sure you understand this. When we're talking about shock, we have to talk about the perfusion triangle. So the circulatory system is made up of 3 components: the heart, the blood vessels, and the blood. All of these are necessary to maintain oxygen delivery to the cells in our body. So when something is interrupted in the perfusion triangle, that's when shock occurs. And you'll see this here on the next slide. So make sure you understand those 3 parts. That is a quiz question. Okay, so shock happens when one or more of these sides isn't working, right? One or more of the elements of the perfusion triangle is not working, okay? So the heart, damage to the heart can happen a lot of different ways. Simple cardiac arrest, so the heart stops, can interrupt the perfusion triangle, which at that point, shock isn't your most important thing. You got to get your heart started in order for you to live, right? But also, blood vessels. Blood vessels can undergo damage or right, you can cut them. You can have internal bleeding, but you can also have if like a body-wide dilation of the blood vessels, meaning they get really large, and so there's not enough pressure to fill the system and push it out to the whole body, or there's not enough blood volume to fill those vessels. Okay, and then of course blood. If somebody is bleeding heavily and they lose enough blood, then there's not enough blood to transport the oxygen throughout the body. Okay, so make sure you understand that whole system. Okay, kind of diving in a little bit more. There are many causes of shock, but just to mention a few, again, cardiovascular or a pump failure, meaning that the heart, I like these visuals, they make it pretty clear. The heart isn't working, so the blood is unable to move, okay? Or maybe there's an obstruction like a heart attack that is preventing blood flow from getting to the heart, and so the heart starts to die. And then a loss of fluid or blood. So this one, right, like the blood is falling out, so there's less blood to go around, okay? And then poor vessel function, and there's another visual of this one on the next slide. So when all these vessels get large and they dilate, right, there's not enough blood in the system then to have enough pressure to get through. Kind of like I talked about with poor vessel function. Again, these vessels can dilate so large that the blood, there's not enough pressure to push it out. A combined vessel incontinent failure is called septic shock. Neurogenic shock, again, is part of this when these blood vessels dilate. Um, you don't need to know those specifically, but understand the basics of it, like understanding that if the blood vessels are too big or there's damage to the blood vessels, that can cause shock. If there's damage to the heart, that can cause shock. If there's not enough blood volume, if somebody is bleeding heavily, that can cause shock. Those are the things you need to make sure you understand. So there are some non-cardiovascular causes of shock, right? So oxygen is really the key when it comes to shock and a lack thereof. So some of the non-cardiovascular, non-perfusion triangle causes per se would be a respiratory insufficiency. So if the lungs aren't functioning properly, either due to damage from a chest injury or some sort of obstruction with choking, that can cause shock. Uh, and then the other type of non-cardiovascular shock is anaphylactic shock. Anaphylaxis, which we're going to talk heavily about this at the end of this chapter, but anaphylaxis is when someone has a very severe allergic reaction to something. And it could be a lot of different things: medications, food, insect stings, any of that stuff can cause anaphylactic shock. With anaphylactic shock, most of the time, the airway gets cut off, and so oxygen is not able to enter the lungs, and therefore you're not able to get oxygen into your blood to deliver to your body. The last kind of non-cardiovascular shock is called psychogenic shock. Um, Most of this is like when you hear the word shock, most of us think like, oh, that person is in shock. This is what psychogenic shock is. So fear, bad news, unpleasant sights can cause a person to faint. Fainting and syncope is the same thing, that word on the page there. But when this person undergoes this, it can actually cause the dilation of those blood vessels, and the person can lose blood flow. And it can be dangerous if it is not corrected. All right, so shock kind of goes through a progression before it gets dangerous. So the first step, I guess, in shock would be compensated shock. So compensated shock is like the body is compensating for it, but they're beginning to go into shock. Things like agitation, anxiety, restlessness, a feeling of impending doom. The person might be clammy, like cool, moist skin, maybe pale, shallow, quick breathing, all that stuff. Okay, so it's more not life-threatening symptoms yet, but you can see it start to come on. Okay, and then you have decompensated shock. So this is when we start to see more of these systemic or full body symptoms, like difficulty breathing, ashen, mottled or cyanotic skin. So skin starting to go blue, eyes start to be dull or dilated pupils. When they start to go into that altered mental state, that is very, very concerning. And if they become unresponsive, then irreversible shock is the person has passed away due to shock. So there is a quiz question about this. Mainly, we're looking for the signs and symptoms of shock. Okay, that's what it's going to ask for. So make sure these are kind of what you're looking for. And then some other things to look for, we're going to want to look for any injuries that may be leading to heavy bleeding. We want to check their responsiveness and their breathing, and then if they're unresponsive. And then from there, if they're unresponsive, we'll go into CPR and those sorts of things. This is just a quick overview flow chart. You can use it to help you study for how you would treat shock and study for a final exam, those sorts of things. Like, is the person responsive? Yes or no? If they're not, what do I do? If they are, what do I do? And from then on. Okay. So as far as what to do if you determine that somebody's gone into shock, the first thing you're going to do, and this is a quiz question, the first thing you need to do is treat their injuries. Okay. If they're losing blood, doing CPR is not going to help because I mean, if their heart is stopped and it's a heart problem, but they are bleeding, CPR is not going to stop because there's not going to be blood to push out through the whole body. Okay, so you need to treat their injuries and get the bleeding stopped first. If the person is responsive and breathing normally, keep the person flat on his or her back. That is to help gravity to assist us with blood flow, right? If we stand them up, for one, if they faint, they're going to fall and hit their head, and that's never good. Um, but also, we want to lay them flat to help blood flow to where it needs to go. The head is the most important part, right? We talked about the brain, that it only takes 4 to 6 minutes of lack of blood flow to the brain before they start to have brain damage. The other body tissues can handle lack of blood flow for a minute. So we want to focus on laying them flat and getting blood to head up to their head. If there's no sign of injury and they're not bleeding, then you're going to want to raise their feet. That's going to help gravity even more to push blood from some of those lower extremities up to our vital organs and our brain, those things that really, really need the blood. Okay. All right. Then, if they're unresponsive but they're breathing, we're going to roll them onto their side into the recovery position to prevent them from vomiting or choking on their vomit, right? We also want to prevent loss of body heat. So, this is going to be taking a blanket, covering them with a blanket, because blood plays a huge role in regulating body temperature. We want to prevent them from lowering their body temperature too much. We're going to call 911. If they are responsive, don't give them anything to eat or drink. That can really lead to vomiting and cause some issues. Especially if they're unresponsive, don't give them anything to eat or drink because they can't swallow and stuff. So that may lead them to choke. Okay, so that's all as far as regular shock and how we treat regular shock. Now we're going to talk about a couple of things in relation to that. So, anaphylaxis, I mentioned it earlier. Anaphylaxis is when our body has a reaction to something that we've eaten or something that we've touched. It's a very, very severe allergic reaction. Make sure you know that it's a severe allergic reaction, not a minor allergic reaction. Okay, it is very major because most of the time it is life threatening. So, some things to look for: may have swelling of their lips, their tongue, their mouth, their nose. Their throat may feel itchy and start to swell. Might have difficulty swallowing or speaking. They can have swelling around their eyes with severe itching and or hives. May have trouble breathing, coughing. They may be wheezing when they're trying to breathe. They may have cramps and nausea or vomiting. Um, it can lead to unresponsiveness, again, if it's not treated. If they have a medical ID tag that says what they're allergic to, that can be helpful so that we can remove whatever they are allergic to from the situation. And again, this table on the right gives us a few more signs and symptoms to look for: rapid pulse, dizziness, flushing skin, large hives, blue skin, cyanotic skin, swelling around their face, and then these breathing symptoms. This is a quiz question, so make sure you understand this stuff. Okay. So as far as what to do, we're gonna call 911. Ask if they've had any previous severe allergic reactions. Um, so we can find out if we find out what they're allergic to, that can give us a better idea. Look for any medical tags they may have. If they have an EpiPen, help them to use it. Okay. Again, this is just another flow chart to help you remember the steps of what we might do. If it's a mild allergic reaction, we're not really going to call 911. Okay, I was going to mention that on the last slide. If they have a rescue inhaler to help open up their airway so that they're not having trouble breathing, then they should be fine. But you do want to watch for a delayed reaction. People can have a reaction up to 2 hours after. So they need to be monitored, keep an eye on them, but it's not always necessary to call 911. Okay. All right. So epinephrine. Epinephrine or EpiPens, and all an EpiPen is it's an auto injector with the medication epinephrine. It's used to treat anaphylaxis because it's a very strong antihistamine. An antihistamine is just like sort of like a anti-inflammatory. Basically, we're trying to slow down the body's overreaction to something. It's like the body, when it detects something, goes into a very severe um, immunoresponse. It's trying to fight off something that it thinks it's going to hurt the body. Yeah. So if anytime somebody who has eaten something or taken medicine or being stung and shortly thereafter starts to show some of these signs, always suspect anaphylaxis. Okay. You do have to be kind of careful with epinephrine. If you're not 100% sure that they have that it is anaphylaxis, and you give them epinephrine, and it's not anaphylaxis, that person needs to go see a doctor because it can cause problems. Okay, they need to be given something. It really speeds up their heart rate, increases your blood pressure, all that stuff. So getting seen by a physician after is really important. As far as how to administer an EpiPen, I put a video in the modules that you guys can look at. That way you guys can check that out because the video won't play on here apparently. So make sure and watch that so that you know how to administer an EpiPen. All right, just fainting. So fainting or syncope, it's the same thing. Most of the time, fainting by itself is not life-threatening. Okay, people can faint for a number of reasons. It can happen for a bunch of different things. Most of the time, when somebody faints, blood circulation to the brain is restored almost immediately, and they come out of it just fine. If somebody faints for no apparent reason and they stay unconscious for a few minutes, they need to be seen by a physician. Okay, monitor their breathing and all those things. If they don't come back after a few minutes, you need to call 911 for sure, and get it taken care of. If they have a history of fainting, it might not be quite as serious. Hopefully you're not alone with that person. Maybe there's a family member nearby that can help you to understand that. If there's not somebody nearby that knows them, make sure you take the safe route. And if you need to call 911, give them a call. Okay. So that is chapter 7. If you have any questions, again, feel free to reach out. Make sure you understand the material that I went over for the quiz. Again, don't forget the quizzes are open note, open book, but use them as a benchmark to help you. Thanks. We'll see you later.